I think one of the key factor would be people, whether it's in the stakeholders, or the participants that you select, or the executives or the admin team that you work with on the ground. It's really the people that make the program work or not work, right? So that's a big part. And I think India really shines because of the sheer number of highly trained professionals who are actually interested in this and they bought into the idea that they can make a difference. So even though they are doing it part-time, they are also practicing in some other fields, whether it's anesthesia or oncology, they are still committed enough to this program and to bring it to their patients.
Have we started our palliative care services? Yes, we have a standalone palliative care OPD as well.
We are into the 5th training of our APHN Lien Collaborative Palliative Care Training in Delhi. And this round we cover 14 institutions. There were altogether about 46 participants.
So, but we'll change your roles. You act as a doctor, so you will know what a doctor goes through. And you act as a nurse, so you know what a nurse goes through. Okay.
Comprising doctors, nurses, and also about 12 faculty volunteers to teach in this class.
We as a group, right, we have done training in India, Sri Lanka, Myanmar, Timor-Leste, starting on new countries. So that's why joining the network, the fraternity of having the palliative care group is so important, and all of you play an important part.
There's really no one system or one way to teach palliative care because we are looking at so many facets and factorial of how the barrier to entry is.
We want each team to have one team leader who is going to answer, which was the first oral analgesic mixture that was available in India for the management of severe pain in cancer patients. Who prepared this mixture?
Dr. Susma Bhatnagar.
Incorrect answer goes to team 4.
The main hurdle we face is a lot of our medical fraternity people, doctors, nurses are not aware of palliative care services, and it's an upcoming branch. So for us it's a challenge to create an awareness in such a way that they will also participate in whatever activities we do, and in that sense the palliative care, the capacity building will increase. So this course in fact has not only given us the knowledge, also has given us a base to improve on those things and to march forward. That's a normal protocol that's followed.
It will be an exciting journey for all of us.
Quality of life is improved.
What was different in our approach? The level of involvement of the participants and the faculty was amazing. Usually we find people come in and walk out and they are not very always there will be some who are not fully interested, but here we had, I don't think anybody has left, and at the end of the day they were still there, and there was a lot of talk and discussion in the breaks, the tea, coffee breaks and lunch breaks, so it's very impressive.
And keep your nurses with you. Okay? Thank you.
This session is very informative related to palliative care, and hopefully we'll apply it in our department. We are very positive about we have created this palliative care in our hospital, and we are looking forward to strengthen it. Let's see, we'll go back and then we'll have a bigger platform, and hopefully someday we can also organize such a program.
And everything wrapped up nicely.
I think we are all relieved, basically. They've come out of their shell. Some of the nurses have been very shy initially, but now I can see them, they have the confidence to talk. They have the confidence to project their thoughts. I think that for me was something that I was happy seeing. Done for the day.
Overall, the whole team was very enthusiastic. They were sitting from 8 o'clock to 6:30 sometime on the same seat, and they were very attentive. When I met Dr. Cynthia, I discussed with Dr. Cynthia basically that a patient who is coming from far away places, sometimes 300 kilometers, sometimes 500, only to get pain management and symptom management, and everybody knows that they will not going to survive, but they are suffering, that's why they are coming to the higher centers. So why can't we start at least pain management in all the centers where cancer patients are getting treated? So this was our aim, and we targeted 100 centers, but now Although Dr. Cynthia is not there, but I feel that this is my responsibility to carry forward till that time I can do. And I feel very happy when we prepare or we mentor one center and they are doing extremely well. There are many centers, they are doing extremely well. They have become center of excellence and they are teaching and training other centers. So overall, it is a feeling of satisfaction. I am really happy with this focused teaching program and training program. And we are monitoring each and everyone individually at what they are doing and what is the outcome they are achieving.